Hi, everybody, and welcome. And hi, do you mind please introducing yourself?
Hello, everyone. My name is Gerson Sorto, and I'm a supervising attorney with Neighborhood Legal Services of Los Angeles County. We're a nonprofit law firm serving the entire county, and I oversee our medical legal community partnerships.
Thank you so much. I want to start with kind of my first question to you, which is, COVID has affected all of us personally. And I wondered if I could ask, how has COVID affected you personally?
We've been fortunate in that we haven't had any immediate family members fall ill to COVID. I also feel very privileged in our work. We've been able to work from home since the beginning of March. I'm a new father, or I guess I don't know how long I can keep on saying that, but I went from being on paternity leave starting November 2019 to then transitioning to work from home with our kids. So I also feel especially privileged in that regard that I've been able to, be home with our kids and see them grow up. It's been an interesting experience for us. We have two kids, twins, and seeing them, interact with each other is great, but they haven't had much opportunity to socialize with other people just due to social distancing and everything else. So we've started venturing out into the grocery stores with them and such, and it's interesting to see them just like look at other people and want to approach others. And hopefully we'll be there soon.
But that's kind of amazing, actually. That's kind of like one of the most positive, hopeful kind of comments I've had in terms of COVID. Like, it's kind of nice to think about kind of like new little people kind of seeing the world and kind of how they're now kind of engaging. So what about in terms of issues that you work on, and for the communities that you work with, in the immediate, but also kind of going forward, what's your sense of kind of like what COVID has meant to LA and to LA County, and just it feels like it's been so intense here, and just to really hear in terms of kind of you and the clients that you work with.
Speaking from a health perspective, I started my career as a health attorney here, and really the pandemic has made clear, I think, what health advocates and others have known for decades, that race and poverty really has a direct and a really devastating impact on health. Looking at COVID-19 statistics, the fact that the toll that this is taking is not equal amongst all of our communities, right? You have Black Americans who are 3.5 times more likely to die of the disease. In California, we know Latinos between the ages of 35 and 49 are dying at 5.5 times higher rates than their white counterparts. And I think that's really sort of lifted up a lot of these disparities, both within race and poverty. And really looking at what accounts for these disparities, at least as we see it, it's really a lack of economic opportunity, a dearth of affordable housing, this widespread food insecurity, and often, a lack of meaningful access to healthcare. In the medical legal community partnership realm, we see that as the social determinants of health, right? So these are different focuses that we have in our work when we look at engaging with a particular individual. We're looking at, is this person housed? Is this person have some sort of connected income or some potential income, looking at food security as well. Is this person safe at home? Does this person have other issues? And I think, as I think about, the legal problems that we've seen throughout the pandemic, they've shifted, I think, as the response to the pandemic has really shifted. I think in the beginning, it was unclear to people exactly how long we were going to be in this state, right? And a lot of the questions were, my employer has said I can't come into the office this week. What does that mean for me now? And then as that extended a little bit, that meant, I think I need to apply for disability insurance because I have COVID, or I lost my job. How do I get onto unemployment benefits? And here in California, we've had, many issues with EDD, the department that oversees those benefits, and we sort of have worked in advocacy there. And then as the pandemic has continued, housing, due to a lot of these other issues, has really become such a prevalent problem that we look to address. And we're lawyers, right? So we're looking to resolve legal issues, but I feel that our teams are often also working in that quasi-social work realm, right? We're helping people connect to different resources. And within our organization, we've done that both in legal advocacy and it's really going in that extra mile and working with patients in different ways. One example is we have a partnership with LA Family Housing, which is one of our local housing providers. And we work with them directly, and we receive referrals from them when they identify patients that are having legal needs, which is great so that we can help resolve those barriers to housing. And that's helpful to the patient. And then on the other side, when we identify someone that we're working with, and maybe that person has 2 or 3 months of rental arrears, but we've been able to do some advocacy the landlord tried to evict them, but now we're able to resolve that. If we can just get that money to pay those arrears, we can go back to our partner and say, look, this is a resolution that we have. Can you work with us? And they can then fund that person's rental arrears. They can help provide a short-term or long-term housing subsidy to keep that person housed and away from homelessness, which is crucial at this time. You know, our offices are located in the communities in poverty where we're needed the most. One of them, you know, is our Pacoima office in the East San Fernando Valley. And we've worked there with many of our homeless neighbors in helping them identify resources, helping them make sure they have what they need in terms of healthcare and benefits, and connecting them to resources for housing as well. The vaccine rollout itself has had, you know, implications for our people in poverty and people in different racial categories, right? We know that not everyone is having either access or actually receiving the vaccine at the same rate. And we see a lot of those issues come up, and we've worked very closely with different partners to not only, you know, educate patients about it, or rather our clients about what the vaccine is and encourage them to take it if they're so inclined, but really bring the vaccine to where they are. So one of the efforts we have is with Building Healthy Communities, part of the California Endowment. And through that partnership, we've actually worked to bring vaccination events into community, into different places, so that now, you know, we have people who maybe would not be inclined to go even to a local Walgreens because there isn't one in their neighborhood. They can then go to this vaccination event and then receive that vaccine that they needed so importantly, right? So we've done outreach with different church groups and school groups and others to really connect with these patient populations that are not being otherwise reached. A most recent example of this is, you know, we are, I mentioned in our Medical Legal Community Partnership Group. One of our big projects connects us with the Los Angeles County Department of Health Services. And DHS's largest hospital site is LAC-USC General Hospital. And we've been plugged into that effort. And as part of a collaboration of organizations there, this last Saturday, we had a team of 9 staff there throughout the day to do a few things. You know, there was a vaccination event that was targeting to vaccinate 4,000 people that were otherwise unvaccinated. Before the event, gathered a large group of volunteers and ended up calling hundreds of our former clients in those neighborhoods to say, look, are you or one of your household members unvaccinated? Do you have a neighbor who's unvaccinated? Not only are we going to tell you about the event, we're actually going to go onto the website and register you for the event and ask questions and eliminate any barriers you have. And we registered quite a few people that way. And then on the day of the event, we were there, and every single person coming through that event received a screening for food insecurity, for health insecurity, and also for legal issues. And so we were there answering questions on the day of and also targeting people after the fact, right? So I think really as we move towards the hope that the vaccine brings, for me, it's always like, how can we focus on these populations and our communities that are often left behind? And I think strategies that put us in community, for us, you know, we really see ourselves as community lawyers, and the advocacy steps that we take sort of represent the needs that our community is presenting. So I think that's a very brief snapshot. You know, obviously there's a lot of other complex issues that are coming up, but those are some major issues that I've seen.
It's amazing. No, that's amazing work. I mean, just incredible work. I have a very practical, technical question that gets raised for me in terms of the vaccine events, which is I'm assuming that the vaccine you're using is people have to come back a second time. And so my question is in terms of how that happens.
There's a lot of outreach that's done, and it really just takes a lot of, I think, either face-to-face or now, you know, phone-to-phone video interactions with members of our community to remind them about sort of the next vaccine appointment that's coming up. Every single person that comes in receives phone calls, and this is all separate from the automated systems that are in place with the county. Like, we have that personal connection with them to say, look, you came in, we honor you for taking that really big step. However, you need to come back. And then, you know, one of the other things that I neglected to mention is that, you know, thinking about, you know, how a lot of our populations that we're targeting are food insecure and income insecure. One of the great things that the LAC-USC campus did was also offer food distribution. So every single person that came that day, in addition to getting access to all these resources like legal help and everything else, was also able to pick up food from our local food banks prepared for them, and as an additional incentive for them to come and bring their families as well. So we try to incentivize it as much as we can. We try to educate people and also understand, right, that I think our client populations or patient populations are, going through a lot. They're maybe still working, maybe they've been laid off. There's a lot going on with them, and honoring that and looking at ways we can connect with them continuously is important.
Totally. No, that's great. Thank you. I really appreciate that. Really appreciate that. I think, again, I think it's just incredible work that you guys are doing.